Welcome back to Understanding Human Anatomy. This video will talk about the regions of the vertebral column and the curvatures that occur in the vertebral column. We'll start with the cervical vertebra. In the cervical vertebra, there are 7 vertebrae in this region. Now, I'll sketch a outline of a cervical vertebra. And we'll find that the spine is forked, which is termed a bifid spine. The transverse processes are relatively short, and they have 2 tubercles on them. And that the body is relatively small in a cervical vertebra. Small and delicate. And this you would expect from the fact that being highest up in the vertebral column, the bodies are supporting less weight. So we have small body, a forked or bifid spinous process or spine, and bifid spinous there. And then we'll find that in each of the transverse processes, there is a hole or a foramen. And this foramen is called the transverse foramen. And the transverse foramen is characteristic of cervical vertebra. And the transverse foramen has passing through it the vertebral artery, it has passing through it the vertebral artery and vein. The vertebral artery is an important artery for the supply of the brain. And so the structures within this foramen are very important. The second region we're going to talk about is the thoracic region. In the thoracic region, region of the chest, has 12 vertebrae. Within it. And looking at a side view of a thoracic vertebra, get the outline of the lateral view of the thoracic vertebra. Like so. And we'll draw a transverse process in like so. The thoracic vertebra have long, thin spinous and transverse processes. Also, we'll see that the thoracic vertebra have articular surfaces for attachment of the ribs. And these articular surfaces appear on the bodies and on the transverse processes. On the body, on the superior and inferior sides of the body, we have a pair of demi-facets and the demi-facets articulate with the head of the rib. And we can point to the demi-facets with lines like so. And then on the transverse process, we'll have another articular surface a facet on the transverse process and the facet on the transverse process is for articulation with the tubercle of the rib. In total, there are 3 articular surfaces for articulation with the ribs. The demifacets for the head of the rib, the facet on the transverse process for the tubercle of the rib. The next region is the lumbar region, and there are 5 vertebrae in the lumbar region. And again, I'll do a sketch of a lumbar vertebra. And the lumbar vertebra has a large body. One major characteristic: large body. And that is because these vertebrae are carrying or transmitting the weight of everything above them. So most of the torso and certainly the head and neck are weighing down on these bodies, these vertebral bodies, so they need to be large and strong to support that weight. They have short but very thick spinous and transverse processes. The muscles that attach to these vertebrae are rather strong muscles, so you need a good, strong, solid structure to attach to. Now, one thing I couldn't put in the drawing, because I'm not that good at drawing it, is that the articular surfaces of the superior and inferior articular processes are vertical. They face outward and inward. That means that the vertebra in the lumbar region cannot really rotate. When the vertebra starts to rotate around the body, the articular processes bang into one another and it prevents movement. So the lumbar vertebra do not provide for rotation. The next region is sacral. And there are 5 vertebrae in the sacral region. And these vertebrae are fused to form the sacrum. And then we have the coccygeal, and there are 3 to 5 coccygeal vertebrae. A little variation there. And these are fused to form the coccyx, our primitive tail. Now, if you look at x-rays, you'll see that our spine is not perfectly straight. It has curvatures in it. And if we look at a fetus or a newborn, in an x-ray, if we look at their spine, what we'll see is that it is curved in one continuous curve. So if we were looking at it, it would be curved like this, and it's curved so that the concave portion is facing anteriorly. And this is the primary curvature of the spine. Now, if we look a little bit later in development, if we look at the spine of a 4 to 5 month old baby, what we'll see is that it's no longer one continuous curve that's concave anteriorly. What we'll see is a curve that's concave posteriorly in the cervical region, and then the remainder of the spine is curved concave anteriorly. This curve that's concave posteriorly is the cervical curve, or cervical curvature, and it's concave posteriorly, and it forms secondarily as the baby develops the capacity and the strength to hold its head up. So by the 4th or 5th month, when the baby is holding its head up on its own, this curvature can be seen in an X-ray. Now if we move a little bit later in development, say a 1-year-old, we'll see that there are now 2 curvatures that are concave posteriorly. The cervical curvature is still there. Then we'll have a concave anterior thoracic curvature, then a concave posterior lumbar curvature, and then the sacral curvature is again concave anteriorly. So, again, putting some labels in here. This would be the cervical curvature. The thoracic curvature, which is concave anteriorly, the lumbar curvature, which is concave posteriorly, just like the cervical curvature forms when the baby begins holding its head up, the lumbar curvature forms when the baby starts staying upright on its own, holding himself upright and starting to stand and walk. And then the sacral curvature, which is again concave anteriorly. So we can say that the thoracic and sacral curvatures are primary curvatures because they are the curvature it's there from birth, where the cervical and lumbar curvatures develop secondarily, or are secondary curvatures. Now, if we have excessive curvature, these are clinical conditions that can be significant. For example, if there is an exaggerated concave posterior curvature occurring primarily in the lumbar region, this is called lordosis, or a lordotic curvature. On the other hand, if there's an increased curvature in the concave anterior direction, this is called kyphosis. And kyphosis is often seen in elderly that are bent over and have almost a hunch back. And any curvature in the lateral direction is abnormal, and this is called scoliosis. So, in summary, we have 7 cervical vertebrae. The primary characteristics are the bifid spine and the transverse foramen. We have 12 thoracic vertebrae, and the chief characteristic of a thoracic vertebra are the facets for rib attachment, the demifacets on the body, and the single facet on the transverse process. Lumbar vertebra are large with a very large body and short, stocky transverse and spinous processes. Sacral vertebra are fused to form the sacrum. Coccygeal vertebra are fused to form the coccyx. The spine has 4 normal curvatures. Cervical curvature, concave posteriorly, that's a secondary curve. The thoracic curvature, which is concave anteriorly, that's a primary curve. The lumbar curvature, which is concave posteriorly, again a secondary curvature. And the sacral curvature, which is concave anteriorly, and that also is a primary curvature. If we have increased lumbar curvatures, it's called lordosis. An increase in the concave anterior curvature is called kyphosis, and any lateral curvature is called scoliosis. Thank you for your attention.